Thanks, Alan. And that really reminds me I should actually talk to you a little bit afterwards, but I had to get my PC not to crash all the time on me. So I want to talk about the cell story and kind of why people are going down this cell pathway. And the challenge with the pump story is, and I kind of showed you a picture of a glucose sensor. It's actually those glucose sensors don't work that well. They're not very reliable. And years ago, we realized that actually the best sensor was the cells themselves. Islets, beta cells are designed to sense glucose on their own, and one can never get a better glucose sensor. They have built into the control system one needs. They know exactly how much insulin to be produced at each time. And there's an additional bonus. There isn't any syringe one needs to fill up with insulin solution. The cells make their own insulin. So at several levels, the idea of using a cell has many advantages over a pump system, no matter how reliable. So the question is, how do you use the cell? What are the issues associated with transplanting pancreatic islets or pancreatic precursor cells? And you've already hinted at some of that I heard in the earlier debate, and that was sort of the need for the tea bag to protect the cells from the immune system, whether it's the immune system associated with transplanting from one species to another, which is kind of where we started, or from one person to another, or even to prevent the autoimmune destruction. One can isolate the cells within a barrier, the microcapsule or the tea bag or the device to do that. The challenge is that islets are limited have limited availability. You need about 1 million islets to treat a diabetic, and that requires, as I gather was mentioned earlier, 2 transplants or 2 donors for 1 patient. And so as a result, there's a great interest in using an embryonic stem cell to make beta cells. It's a much more primitive technology compared to transplanting pancreatic islets, but certainly is feasible now. The challenge, you still need to end up using the capsule or the tea bag to protect the cells from an immune response. And so the key part is, how does one design that tea bag? And then let me just finish by reminding you what we're trying to do here is that we're trying to generate a treatment for diabetes that makes the disease forgettable, so that the diabetic has 1 injection every 6 months, every year, of cells that then eliminates the need for them to think about what they're doing, allow them to go and have a beer or whatever whenever they want, to exercise without worrying about things, to having their life not interfere with what's going on. And the only way to do that is with cell therapy behind a device like a tea bag.
Okay, so my rebuttal is very simple. I don't want tumors. I don't want autoimmune rejection problems. I don't have any of that with the pumps. I do like the story about the sensors and improving the sensors. So I think we're actually looking at the problem a little bit wrong. Why aren't we looking at using the cells to actually be the sensor for the artificial pancreas, where we do the pumping just as we want to do right now, but we have a much better sensor. So I think what I'd like to see is how we get the information from your cells so that we get it in a useful way that we can put into the pumps. I'm not sure how possible that is, but I think that's certainly the way that I would like to go. I don't have a whole lot more to say other than in terms of what I've heard, and before I came today, I knew even less than I do now about stem cells and using them for diabetes. So you can imagine how much that was. But from what I've heard, we aren't actually at the stage where we can use this right now in humans. Thanks, Derek, for telling me that earlier. Right now, what you've got is you've got pumps, and there's no reason not to be working on stem cells or other cells in terms of the treatment, because the thing that we eventually want is a cure. And I hate to tell Michael this, but I don't see any way that the pumps are going to land up with a cure. Okay.
I'm actually pleased, and I'm surprised actually, that you ended by saying that pumps won't end up in a cure. I mean, I think that you just put the reason to sort of stop working on pumps. I think pumps are great. They are the here and now. They have great benefits to many patients, particularly patients who have kind of unstable diabetes or unusual forms of diabetes. There are particular risks with simple injections of having hypoglycemic episodes in the middle of the night when you're not able to awake from them. And so pumps have had a remarkable achievement in bringing us from a kind of crude injection today, sort of from the days of Banting and Best, to kind of the current technology. But the challenge is these glucose sensors don't work. They actually are glucose monitors, and so you can record the glucose levels, but you wouldn't use them. The results aren't good enough. There is enough reaction to the end of the sensors that you actually can't rely on those numbers to drive a feedback loop to work a pump. And so, sure, you can put a cell at the end of some sort of pump, but why would you bother with the pump when the cell's making insulin and doing everything you need from it, and you can have control of the immune and inflammatory response to make these successful. We'll need time for that to happen. So the cell therapy is the future. And actually, more intriguing than that, and getting back to what Alan ended by the question of a cure, almost the point of doing the cell therapy is not to deliver cells, but to figure out the small molecules that are needed to cause the cells that are already there to repair themselves, to regenerate, sort of a process called endogenous repair. And so the idea is actually, let's try to use these as our interim level until we get to the real treatment, which would probably be a small molecule that causes the pancreas to regenerate, and then we don't need any of these kinds of devices altogether. But of course, that's all the future.